screening. So we are not able to reach to majority of women and aim for early detection. So there is an urgent unmet medical need for a screening test which has high sensitivity, which can detect early stage breast cancer with good specificity and a reasonable cost and easy accessibility. And that's why with EasyCheck Breast, we have a simple blood test for screening of early stage breast cancer in women who have absolutely no symptoms. We often see that early stage breast cancer does not give symptoms. Women come with symptoms when the disease is progressed. And that is why this EasyCheck Breast promises to detect the breast cancer specific circulating tumor cells from only 5 ml of peripheral blood, which is drawn from the convenience of your home or your office or reach anywhere, even in tier 2, tier 3 cities. What is EasyCheck Breast? This is a blood test where we take only 5 ml of blood. Once it is reached in the laboratory and all the other red blood cells, which are a lot of blood cells in this blood, are removed, and we are trying to detect if there is any cancer. The circulating tumor cells will be in your blood. They will be in your blood only if there is cancer. They are not detectable in patients who do not have cancer, and they are not detectable in the blood of patients or people, I should say, who have benign lesion or who have a lump which is not cancer, not malignant. So it is very important to differentiate between the lesion which is there, which is not malignant in earlier stages. So we detect these cells at the end of a very intensive 5-day protocol where all other cells die because there is a epigenetically modified cell stabilizing medium. I would like you to excuse me for using more technical terms, but what this medium does is it deletes all the other cells, so deletes the noise of what you can say, and actually if there are cells at the end of 5 days, they are characterized or profiled using specific markers for breast cancer. So there is a circulating tumor cell marker as well as breast cancer marker, which makes this test more specific and more accurate to diagnose. So if you see these colorful pictures, these are the images of breast cancer specific markers. This was based on the technology where more than 8,000 asymptomatic women and 217 breast cancer women were screened and the accuracy calculated. So let us look at the figures. This is for earlier detection, accurate detection. The specificity is more than 99%, the accuracy is more than 99%, and sensitivity is very high, closer to 90% in 88.2%. I would like to draw your attention to the third and fourth line, ladies and gentlemen, because Datar Cancer Genetics was able to detect more than 80% cases in stage 0, more than 90% cases of stage 1 breast cancer, these circulating tumor cells were detected. Also more than 95% cases in stage 2 and 3 and more than 100% and in 100% in stage 4. So who is this for? This is for all women who have absolutely no sign or symptom of breast cancer and who are over 40 years of age. What happens if the test is negative? The negative test means there is no circulating cells specific to breast cancer detected at this moment in time in your blood sample. What does a positive test mean? A positive test means that currently we are able to detect circulating tumor cells specific to breast adenocarcinoma, and you need to be referred to a physician. You need the advice, you need the guidance about the standard of care pathway, how to go forward, how to investigate further and know where these cells are coming from. Trinatra Breast is another name of EasyCheck Breast, exactly the same technology which was awarded as you saw in the 1-minute video, which was awarded Breakthrough Device Designation by US FDA as an early detection tool for breast cancer. This test is being carried out by Datar Cancer Genetics. We are a world-renowned cancer genetic laboratory based out of Nashik, and we are accredited with ISO, NABL, CAP and CLIA. And EasyCheck Breast is also being marketed. It has a marketing authorization in European Union with CE-IVD mark. This is a very important slide because we do not aim to replace any standard of care screening modalities which are in place for early detection of breast cancer. We aim to reach out to more women from tier 2, tier 3 cities who have no access to healthcare, no access to mammography, no access to the expertise of physician, and who do not come forward for screening from the fear of undergoing screening programs like mammography or ultrasound.